are again for Let's Talk, the award-winning podcast series produced by Hazel and Betty Ford. I'm your host, William C. Moyers. I'm also an alum of the organization. In 1989, I began my journey from addiction to recovery and beyond to this moment. Welcome to this conversation about postpartum depression and substance use. Our guest, Dr. Alta DeRoo, the Chief Medical Officer of Hazel and Betty Ford. Welcome, Alta.
Thank you, William.
Thanks for being with us today. I've got to ask you before we dive into this very serious subject, how did you get interested in addiction medicine, considering that you came from the 24 years of service in our military, and also you're an OBGYN? How do you match those up?
Right. So I was an OBGYN in the military, and I had a personal history with addiction. So my father was alcoholic, and I'm also in recovery. And when I started seeing more of these patients in recovery, I started getting interested in the actual treatments and the medications and the medicine of addiction. And so there was an opportunity for me to work in a clinic while I was still in the military. And I was able to treat patients with substance use disorders and become board certified in addiction medicine. And so when I retired from the military, I combined the two of treating pregnant patients with substance use disorders as well as their partners. And then it grew from there, and it's become a passion.
Well, we're so glad that you brought that passion and that remarkable expertise to this important leadership role at Hazel and Betty Ford, Chief Medical Officer. Did you ever think you'd become the CMO of an organization like this?
No, William, I didn't. I was incredibly humbled for the opportunity. And at first, I didn't think I was worthy of being, leading medically such a great organization whose mission I shared, and I was aligned with all these principles. And then when I saw that what we were all about and working here as medical director for a while, learned more about it. And then there was no doubt in my mind.
And there's no doubt in our mind either. We're so glad you're here. Let's talk about this very serious subject of postpartum depression. What is that?
So postpartum depression is a true medical diagnosis that can happen anywhere from 2 weeks to 6 months to a year from a mom who just delivered. And postpartum depression is marked or heralded by changes of function of the mom, where she can't get out of bed, or she doesn't want to shower. She cries a lot at the simplest things. And not to minimize it at all, but the things that she wouldn't have normally got upset about before. But it goes a little deeper. It affects eating too much, not having an appetite, not enjoying time with friends that you used to enjoy things with, not doing the activities that you used to enjoy. So it's where this diagnosis truly starts to hit the functioning of the mom.
But what's the difference between postpartum depression, a very serious condition, and baby blues?
Yeah. So baby blues is something very normal that most moms experience within about 2 weeks of baby delivering. And that's going to be a hormonal change that happens after you deliver a baby that causes us, meaning me, I'm a mom too, where we may cry, we may be more emotional, but we can recover from it. And it passes after the 2 weeks. The baby blues can be helped by exercise or hanging out with the people that we used to, or baby blues can be exacerbated by not sleeping enough. So you see the trend here is that the baby blues is treatable. You do a little self-care, you ask for a little extra help, and eventually these baby blues pass. But when the baby blues start turning into a dysfunctional way of being, and now you can't take care of yourself or your baby, that's when you need to seek medical help for the concern.
And postpartum depression, there's got to be a connection between it and substances, yes?
Yeah, so there is literature out there to show that when a mom who may be dependent or may have an underlying substance use disorder, perhaps they are abstinent from that coping mechanism that they had during pregnancy. Well, now they're at increased risk for depression if they haven't gotten those coping skills, if they haven't achieved those coping skills and not using that drug or that medicine anymore. Also, another high risk population would be those patients who have had a history of depression, not even a history of postpartum depression, but just any history of depression increases your risk for postpartum depression. But we do see a correlation with a substance use disorder and pregnancy and then postpartum depression.
How does a woman begin to determine if perhaps her use of substances is crossing that line and pulling her downward?
So probably the biggest thing to do is share it with your OBGYN, either while you're pregnant or postpartum. So there are, we do surveys when you're pregnant called the Edinburgh Depression Scale. And we can ask you certain questions that will give us insight as to maybe there are some symptoms there of depression. And we do that early in pregnancy, also in your third trimester, and it's done in your postpartum visit. And this is a way for us to screen people who might have signs and symptoms of postpartum depression or even a substance use disorder that may be contributing to the postpartum depression.
Can postpartum be treated with medications?
Absolutely. Yeah. So the medications that we can treat to postpartum depression are the same thing that we would use to treat any population, even a mom who wasn't pregnant. There are some kinder, gentler medications that we can use to treat a mom with postpartum depression. Zoloft is a good one. A minimal amount of it gets into breast milk. So that's a one that we tend to favor.
But drinking a glass of red wine or using marijuana or taking an extra pain pill, those aren't good ways to address postpartum.
No, and especially not the marijuana. Remember, that is, there's going to be some toxins that leak over from marijuana ingestion or perhaps on the clothes or any type of smoking. So we would not want to cope with any of that with marijuana. Marijuana is also a depressant. So if it's a depressant, a CNS depressant, and you're already depressed, that's not something that's going to help your mood. Would also suggest the opioid. If you're getting an upper effect from an opioid, that's a big sign that that opioid is not for you. That's actually one of the indicators where somebody has a risk for developing a substance use disorder to opioids is when you actually feel energized from taking that opioid. So that's actually a really good question.
So breastfeeding, I mean, new moms have got to breastfeed in most instances. How do they manage that responsibility to the baby while taking their legitimately prescribed medications for their depression or their opioid use disorder?
Almost all medications are safe for depression medications or anxiety medications. Psychotropic meds are safe in breastfeeding. We have to keep in mind that even a little minuscule amount of medication is going to get through the breast milk, but not enough to affect baby on a large level. And if you are concerned about it, one of the things that you can do is after you take your medication 1 to 2 hours and you are going to breastfeed, you can pump your breast milk and then dump that. And then maybe later in the day, you can breastfeed baby directly if you're concerned about your levels being high. But rarely there are any medications that we would say don't breastfeed your baby. It's more of the substances that, or illicit substances that we would discourage moms from breastfeeding. So if you're using marijuana or methamphetamines and you're breastfeeding, we strongly discourage that.
Dr. DeRoo, let's talk about how a new mom or a mom a second or third or fourth time, not necessarily just a new mom, but a new mom, how does she take care of her mind, body, and spirit, particularly if she's in recovery, while also taking care of the needs of the new baby and maybe other children in the house?
Right. The first thing that comes to mind is ask for help. Seriously, you don't need to do this by yourself. There's so many other moms, so many other support systems that you can rely on to get that rest so that you can indulge in some self-care. And then you can return to the fight stronger, battling those other 3 kids that are demanding your attention. So I would honestly say, please don't be a hero. Reach out to another mom, ask for help. Let us help you with this really tumultuous period of your body recovering from this, 9-10 month pregnancy, and then this huge change in hormones in your body. So you don't have to do it all alone. We're here to help you.
On that note, what role does the partner or the significant other play in support for the new mom or the mom again?
Yeah. Mom is the vehicle through which that baby thrived. And now babies can maybe depending on mom for breast milk. That is a lot to put on the mom. If the partner can set some time aside to maybe take the kids or take something off mom's plate, that would be tremendously helpful for mom to be able to indulge in some self-care.
If there's a woman who's listening or watching to this Let's Talk podcast right now and tuned in because they are worried about their own use of substances within the context of postpartum depression, what's your counsel?
Please come see us, or please see some provider that can help you along the way, whether it's medications or not medications, therapy, counseling, support. There are tons of resources out there. And the weight of this substance use right now seems tremendous. And if you're thinking about your baby and postpartum and recovery, your mind is in the right place. Let us help you get there safely by helping you stop your substance use disorder, getting it under control, developing a plan of recovery for you. Really, come see us. And when I say us, I mean people who want to treat those with substance use disorders. Come see us. We want to help you. We check shame and stigma at the door. There's none of that here. And we're more concerned about you and baby and getting well rather than any of the judgment.
So, Dr. DeRoo, what's your response to the new mom? She's just given birth, say, 8 weeks ago. She's got her hands full at home. And she knows that there's something going on with the substances that she's using. She might not call it a dependency, but she's got something going on. She's tuned into this podcast. What's your counsel to them in terms of getting help?
I've been there, William. I do remember those days. And you may be tired and frustrated. You're relying on this substance and you're afraid to stop, but you don't know who to turn to. I would say the first person would be a counselor, a physician. If you have a primary care provider, maybe somebody in your community. There are people out there that do want to help with your substance. And let us also assist you with determining whether this is at-risk use or perhaps you do have a substance use disorder. Allow a medical provider to assess you and get you some help. Drag those kids with you. Bring them to the waiting room. I've seen it. I've been there in the waiting room with 3 kids running around, but you need to think about you before you're going to be a good vessel to take care of the kids. So this would be the time to put your care first and go out there and get some help so that you can be there for them next month and next year.
Because asking for help isn't going to be, the response isn't going to be punishment. They're not going to take your kids away from you.
Absolutely not. No way. Absolutely. Especially when you're going to a medical provider for help. When you're going to a medical provider for help, there's an understanding and there are laws that will protect you too.
Very good. Dr. Alta DeRoo, thank you for your personal passion, your remarkable expertise in bringing it to our listeners today. I think the message that you leave with us is that there is hope and there is help and there is healing no matter where you are along the continuum. If you're a new mom or an older adult, hope is what gets people to the help and to the healing that they need.
Absolutely.
Thank you, Dr. Alta DeRoo, the Chief Medical Officer of Hazel and Betty Ford. And thanks to all of you for joining us. Remember, addiction to alcohol and other drugs does not discriminate, but treatment works and recovery is possible. So don't wait. If you or a loved one or your baby needs help, ask for help. Do it now. I hope you'll join us for another edition of Let's Talk. See you soon.